brain to learn how to play the piano. If you play, like Dr. Gates said, if you play the piano over and over again, or like our young man who was the math genius, you do math over and over again, your brain's going to learn that. You're actually going to get neurons that are going to you're actually going to get brain cells that are recruited from other areas of the brain to help you do that if that's what you concentrate on all the time. The combination of things that Dr. Gates just talked about results in your brain learning pain. Not a good thing.
And then your brain can't shut it off.
And then your brain can't shut it. And how do we shut it off? People ask what kind of medications. We use the medications. But those of you
we don't use medications.
We don't use the medications. We as a population use the medications. And usually by the time a patient gets to us, they've tried the Neurontin, they've tried the Lyrica, they've tried the Nimble, they've tried the Savella. By that time, a lot of them are on to like the more serious pain medications. But basically, some work for some people, some don't work for other people. Most work for a short period of time, then you have to go to another. But it's shutting down basically your brain's ability to perceive pain.
Mm-hmm. Let me interject.
Go.
So, okay, I can't withstand it.
No, that's cool.
So, Arthritis and Rheumatology 2014, disrupted brain circuitry for pain-related reward/punishment and fibromyalgia. Look it up. Okay. That's all I have to say.
I wasn't even listening. I had fibromyalgia.
Good.
No, well, I did have it. Disrupted brain circuitry for pain-related reward, punishment, and fibromyalgia. Okay, so that's talking. That's
about exactly what we're saying.
For those of you who are research nerds, look it up. For those of you who are not research nerds, just know it is in your head. And without addressing the aspect of the brain, for those of you who are, for those of you who are looking for non-drug methods for this, okay, technically the medical approach addresses the brain, even though that you're not aware of that. It dampens the brain's mechanisms by using these drugs. There's a trade-off, and if you have never come upon an alternative method that's been successful for you, maybe that trade-off is okay. But eventually just know you're going to suffer from that. You're going to suffer side effects from having your brain neurons dampened for over a period of time. And again, I'm not an anti-medicine.
Neither am I.
That is it's a valid way to go if you're not aware of anything else. The problem in the alternative field, and I'm not anti-alternative field either, but the way that the alternative field has developed is, and it's our whole society. Let's try and figure out an easy way to do this. I'm going to tell you, there's no easy way to do fibromyalgia. There's a way to do it, but it's not like going to be a pill. It's not going to be some people know that the gut is heavily involved in fibromyalgia. Let me tell you, the gut is heavily involved in fibromyalgia, and that's a whole discussion into itself, which we will eventually get into, not today. But if you fix the gut and you don't fix other things that are involved, the gut might help your brain, but if the brain's still desynchronized, or you still have that mechanism that is being overwhelmed, the pain's just going to come back. By the way, that mechanism damages your gut. So you have this vicious cycle that you have to break, and you have to break it here. You have to break it in the brain. I mean, it's pretty, when I do a talk and I say, what does the brain control?
Everybody says everything.
Everybody says everything. Everybody gets that the brain controls everything. But for some reason, it's hard for us to embrace that when brain function is abnormal, it creates a lot of these chronic situations that we have. And because there's not a drug for it, and because the science isn't really friendly towards the alternative fields, we're not really conversant with the fact that this is where you got to go. You have to affect, you have to treat, you have to acknowledge that the brain is there. There's tons of non-drug ways to do it, but I started to say in the alternative field, we still are kind of in the berberine thing, which we use in different cases. We're kind of still in the take curcumin, take curcumin. Effective. We're back now to the inflammatory thing.
B vitamins, mitochondrial support.
Yeah, all these different things, and these are all, I call it nibbling. I'm not criticizing. It's an evolution that has taken place that has allowed us to get where we are, frankly, in a sense of a full comprehensive understanding of what's going on. But this is a complex comprehensive issue that demands a complex, comprehensive history, exam, and solution. But our challenge is continually to get people are now kind of conversant and able to embrace an alternative method, cleanses, the different types of things that Dr. Gates talked about, vitamins, supplement, herbs. Ironically, herbs are not good. A lot of herbs are not good for our types of patients that have these problems. But we're just still looking for ways to better educate people and help them to embrace and understand the brain is part of it. And the brain can be evaluated without sticking you in an MRI, although it's helpful, without doing an EEG on you, although it's helpful. But it can be functionally evaluated through a thorough neurological exam, something which most of you have never, ever had, and probably never will have in this lifetime, unless he does it. Unless one of us do it, but he does it all now because he's better than I am at it. And so, so unless you get that, you can tell what parts of the brain aren't functioning right. We had a patient who was in here yesterday again, and this patient was diagnosed with multiple sclerosis. I'm absolutely certain she doesn't have it. But she had an MRI finding of her brain that could be something else, and we happen to think we know.
She had a negative CSF study.
Yeah, she had the one major test for multiple sclerosis, which is a cerebral spinal fluid test, was normal. And it's probably because she doesn't have multiple sclerosis. It's probably because she has another inflammatory thing, which we happen to think is her thyroid, because she's like screaming autoimmune thyroid problems, which can create inflammation in the brain. So again, I want to make this point relative to diagnosis. We're hitting a wide spectrum here of the questions that we see that people want to know online. Diagnosis. Can you look at somebody's brain and say they have this problem? Not unless you have a really comprehensive history that says, okay, it could be these 80 things. By the time you get down with the history, now you go, okay, it's down to these 5 things. Now you do an exam and go, of these 5 things, it can only be these 3 things. Now you look at the MRI, and now that inflammation has meaning. That's diagnosis, folks. It's probably been that way since I was in school, and that was in the mid-70s. And nothing's changed, but we've gotten to the point where, I mean, back then we didn't have MRIs. We didn't have CAT scans. We didn't have all this stuff. We knew that the blood testing wasn't consistently like something that you wanted to hang your hat on. So we were taught you had to do a history. We were taught you had to do a thorough exam, and then that your testing should be targeted and specific. I mean, we don't do that much testing, really, if you think about it.
Right.
We do very targeted testing and very testing that is useful, but compared to what our patients have experienced when they get in here, oh my God, I mean, geez.
And I think we've hit our hour.
Well, we started late, but you know that's okay. I think we've probably gone over. What we really want to do is like give you some sort of an idea of the overall of fibromyalgia. You feel like we did that?
Yes.
You feel like there are 4 different essential categories that we have observed. Okay, I wouldn't look for those in the literature in that category, because this is where we work. This is what we do. We base our observations on what we do and the successive response to treatment to the things that we find, and we get pretty consistent results these days as a result. But Dr. Gates certainly here to introduce the literature to show you that that we're attentive to what's going on out there, and it's out there. The things that are wrong with you are out there. They just maybe aren't conversive to the present medical model. That's something you need to know. You need to know it's not in your head. Well, it is in your head, but it's not in your head. Okay, it has a lot to do with your brain and the way it perceives pain and the way it experiences pain, but it's not in your head. You don't need to go pull on your big boy pants. You don't need to go to see a psychologist. You're not crazy. You need, and if you're a husband or a significant other, you need to have them look at this so they know you're not crazy. I can get into the left brain, right brain thing. I can get into the symptoms of how you have brain fog. We'll do that another time. Brain fog and short-term memory loss, and how you're not motivated because your left brain is probably totally trashed by this, and you're probably late to appointments, and on and on and on and on. We could talk about this for like probably 25 hours. But the reality is we felt like we wanted to lay a baseline for you and let you know that there's a lot of science behind what's going on with you. And there are a lot of things that can be done if you know where to start. We just kind of want to give you an idea of where to start and what you should be looking for in a physician if you are going to someone for fibromyalgia, and the fact that it's real, the fact that the term is dumb, the fact that it doesn't mean anything, the fact that it's multifactorial, the things that will set it off, and the things that will perpetuate it. So I think we've kind of covered that.
I think so. I think we also need to reiterate that our program seems to work because we properly select the right patients. People who come to us will do what we need them to do in terms of changing their diet, their lifestyle, these stressors. And we feel that is a major component why we're seeing some success, we'll say it that way, with our treatment population. And if you're interested in learning more about us, go to powerhealthtalk.com, powerhealthtalk.com. Go to the top bar, that's where the hangouts are, and we'll be putting more of these out every week.
Can we access our website?
Yeah, powerhealth.com.
Is that our website?
Powerhealthreno.com.
I'm computer illiterate.
Powerhealthreno.com.
Figured that out by now.
And then we'll have some more snippets that we're doing today on thyroid.